Hello, everyone. This is Dr. Susan Mara with Dr. Mara's Medical Minutes. And today we're going to talk about the infections of Anaplasma and Ehrlichia. They are both tick-borne infections, and they actually both affect dogs. And in fact, Ehrlichia is bad news for dog joints. They are also found on horses. So, farm animals are, you know, sort of more vulnerable to those infections. In humans, Ehrlichia and Anaplasma, one is called human granulocytic anaplasma, the other one is called human granulocytic Ehrlichia. They're very similar, but they are different bacteria. You do use the same drugs to treat them, and I will say, thank goodness, they're some of the easier tick-borne illnesses to treat, unlike Borrelia, Babesia, and Bartonella. Generally, when you have a patient with Ehrlichia and Anaplasma, you can use like a combination of Doxycycline and Rifampin with some herbs like BB1, BB2, BB3, and maybe even some Biocidin. And generally, you can get rid of these infections, depending obviously on the pathogen load that the patient has, which, by the way you measure them is through antibody titers. So, an antibody is a molecule that's made by the B cells, the B cell wing of the immune system, and those B cells produce antibodies, and those antibodies bind to the pathogen or the allergen or whatever the offending agent is. And they do so to try and help neutralize it. So you do see Ehrlichia and Anaplasma titers, but usually they're low. They're usually like 1 to 40 or something like that, which you'll if you look and see, it'll say it's like borderline positive. I'm not quite sure what's going on with that, other than it might just be that the immune system has developed a tolerance to those infections, and they too are intracellular infections. They can be very disfiguring to your joints if they go untreated and undetected. So you can get like just really craggly looking joints from particularly, I would say, Ehrlichia, but I've actually seen it in both. So again, the importance is to get tested, get a full tick-borne illness test panel, preferably through Igenex, because I think they do the most accurate testing. And generally, we use a 14-day provocation, and for women, we have them do it a couple days before their menses. And between the provocation and a couple of days before the menses, and jump on a trampoline for half an hour and get a lymph massage, usually we can find these organisms and we can treat them. So Ehrlichia and Anaplasma, I would say, are the least of our worries. However, you don't want them lingering around because they cause immune dysregulation, right? The immune system is trying to fight them. It doesn't want them there. And so it's just another weight and load on your immune system, which you do not need. And they'll be the first to go. If, let's say, a lot of my patients have Borrelia, Babesia, Bartonella, Ehrlichia, Anaplasma, Rickettsia, they'll be the first two infections to be treated and be done with. You don't really see lingering Anaplasma and Ehrlichia unless you get continually bit or you haven't been properly diagnosed. So I hope you found this information useful, and I hope you have a wonderful day. Take care.